Okay. Today is Wednesday, November 15th, 2017. This is Hannah Crawford for the Global Polio Eradication History Project. Today I'm interviewing Dr. Elias Durry in the broadcast department of the U.S. Centers for Disease Control and Prevention in Atlanta, Georgia. Mr. Todd Jordan is our videographer and studio engineer, and Dr. Durry and I have had one pre-interview session so far. Dr. Durry is currently leading the outbreak response team in the polio eradication branch of the Global Immunization Division of the Center for Global Health at CDC. In 1995, Dr. Durry was hired as a medical epidemiologist in the polio eradication activity, and since then he has been repeatedly seconded to WHO for in-country positions as team leader, senior advisor, and emergency coordinator, among other roles. Dr. Durry is acknowledged for working in, quote, the most difficult and complex countries in Africa and the Middle East, quoting this from an introduction from when you were awarded the William C. Watson Jr. Medal of Excellence in 2013. These countries include Yemen, Somalia, Sudan, Nigeria, India, and Pakistan, where Dr. Durry coordinated intensive polio campaigns during attacks on polio workers. The Watson Medal bio continues. His technical knowledge and analytical capability allowed him to formulate and analyze policy to achieve polio eradication in these difficult countries. His management and leadership qualities allowed him to oversee the planning and utilization in the Horn of Africa, Nigeria, and in Pakistan. With his diplomatic skill, he was able to negotiate with warlords in Somalia, fighting factions in South Sudan to secure safe and favorable conditions to conduct immunization activities, and with religious and traditional leaders of northern Nigeria to resolve the suspension of vaccination. Today, we're going to be talking about your direct experience in these countries, Dr. Durry. In addition to your background, we're going to get some contextual background information. This is the first of probably 2 interviews, and I think possibly 3, depending, because we are going for a level of detail. So I'm really excited to talk with you, and thank you for being here.
Thank you very much for having me.
Great. To begin, would you introduce yourself by name, state where and when you were born, and talk a bit about your early life?
Thank you very much. My name is Elias Durry, Elias Durry, Elias Durry. A lot of people call me different way, but as long as you don't call me hey you, that's fine. Yes, my name is Elias Durry. I was born in Ethiopia, in the capital city of Addis Ababa. Grew up in the eastern part of Ethiopia that's called Harar region, specifically in a town called Durry. I did my high school in Durry in the city, and I did about a year or half a year of college education was in 1974. But during those days, Ethiopia was going through its first revolution, recent revolution, where the monarchy was overthrown and a military government has taken over. But that 1974 was right before those happened, and I was somehow lucky enough to, not on my own work, but with my brother's help, to get a scholarship to do medical school in Hungary. Budapest, Hungary. So I traveled to Budapest, to Hungary, September of 1974, and I completed my medical school in 1981 in Hungary. From there, there is a lot of story in between all of these, but eventually I came to United States as a refugee. That was processed while I was in Hungary because of some of the persecution that was about to unleash on those of us who were opposing the government. I arrived to the States, to Los Angeles in '81, and while I'm trying to do my ECFMG or special exam to validate my license, my MD degree. I was working at the dialysis unit as a technician while studying, and then while I'm taking the exam, I also thought that my work actually will require much more of public health flavor in it. So I did a master's of public health at UCLA in Los Angeles.
Why did you think that your work would be more in the persuasion of public health?
From the time that I wanted, from my childhood, it's not that I wanted to be a medical doctor because I want to be rich, but I really just want to. I always thought that what we need to do is to serve, and that serving part, and the reason I went to medical school is also to do that, and my intention was really to go back and work in Africa, but that was not something that could be done at that time, and coming here. Was also with I always had that feeling of that that's where I need to go back in and work, and the other thing is, and I think it has some future impact on what I would say also is I said, I would never said this before, but let me say it. I said I was working at the dialysis unit. And it was a 12-hour shift, and with 2 shifts of patient that stay there for 4 hours, so it takes like 5 hours. And at the end of the day, you always have few minutes to just wait for the clock to tick. And it was a very powerful song on the TV. That was the "We Are the World" song. And when I saw that, I just got up the next day, went to UCLA, met with the professor, and I told him I need to go and I need to do the master's in public health, no matter what happens with my medical internship and residency. So right there, he said, "Okay, you're welcome." And few months later, I started my MPH work there. So and then from there, I did my internal medicine residency in Harrisburg, Pennsylvania.
Could we pause for a second, because I have a few follow-up questions. What was it about being in the dialysis unit and hearing "We Are the World"? What was it about that song?
It just did not click because, here I am, not undermining what the dialysis unit is or what you achieve there, and it is important work. But to me, it was it's a one-to-one, where you can do only so much only for few, although what you are doing is also a noble thing. My thinking was, there is more I could do to really reach out and influence the lives of bigger member of societies, which is really the perception of what public health is. We are not undermining the importance of individual care, but we always look for how we impact, in a big way, and I thought, that doing something that have a massive or mass impact is where I always wanted to do and to pursue that. So, I mentioned earlier also about, when we were medical students, we were not really much thinking of what would be, because as I said, I may not have said it, but it was really a very, active student movement. And those movements were not based on what happened to me. For example, I told you that I obtained scholarship, but I never applied for that scholarship.
Could you say more about that?
Yeah, I never applied for a scholarship. I was out in the field, organizing people and organizing, opposition and all, especially working with farmers, at areas where there was a lot of famine. My brother didn't like the route I was taking. So he went ahead and applied for a scholarship in my name to, I think at that time it was to East Germany. Then, I don't know if you know what Peugeot 504 means in Africa, but that's a car that goes everywhere. So one day a car came and said, they're asking for you, you have to go to Addis immediately, and then they just...
Addis Ababa?
Yeah. Then when I reached it, they told me, well, no, nothing happened, but you need to go for an interview to this embassy. I went for the interview, and I just told the guy I did not apply for this scholarship, and I don't want to go. And what we were saying is, we have a job that we started, and it's just very difficult for me to leave it and go. I will go to school later on once we. And then the guy said, you sit down over there, you're going. And he said, well, by now our positions are all filled, but let me call the other friendly countries. And he called Hungarian embassy, and he says, okay, you got to take this one.
Could you back up a bit further and talk about the organizing you were doing? You mentioned farmers.
No, it was just, for us, what we did was we closed the college, in the middle of the uprising. And not that the college the university was closed, but we ourselves said, we shut it down. And rather than just going home and doing nothing, we volunteered to go and distribute food, in areas where there was famine at that time. So we just, paired up with the, big NGOs. I think that those NGOs was a Swedish NGO. And I was at the Somali region of Ethiopia. All of us, we just took it on our own and went out and started volunteering for it. Individually,
you went out into the field. Could you talk about where you went and what you saw?
It was of course, it is time where the famine was or the starvation was not only in one part, but it was really across the country from north all the way to the east. So there was no shortage of where you wanted to go. But I went to the Somali region, and which is not far from where my home is. And of course, it is always devastating to whenever you travel, you start seeing, starting with the dead animals, and then as you move in, children in the situation that they were in. So it just highlighted why we had to do as students too, not to see those kind of things repeated, although it may be utopic, but that's how we were believing in it. It was really a worthwhile, time to spend, even if you haven't changed somebody's life, at least to be, not to just say that, I'm doing well in the city, but to go out and do whatever you can and to volunteer for it I thought it was, it was not extraordinary thing to do.
Could you talk a little bit more about your family and your brother growing up? What was your family like?
We are a big family, and not only big within ourselves. There were 10 siblings, but we also have, a very extended family. Your cousin is your brother, but also from extended blood family. Also, your neighborhood is another, nourishing environment where you just feel, whether you are a child or an adult or whatever, that there's always somebody there to kind of, of course, as a child, somebody who can guide you, as somebody who can protect you, and then depends on what you want to do, and then you just keep doing it, and no matter what, it was really a very good, situation where we say, takes a village to raise a child, kind of. That was a kind of environment that we grew up with, which I don't think is there these days.
Probably depends on where, maybe. Yeah. To get even more specific, could you tell a couple stories from your childhood that connect to where you are today?
I think two things in addition to this situation when my brother applied. I think, well, again, it's hard for me to say it, but I think if I was not also accelerating in the school, I would not have been here. The reason I'm saying is twice or three times I was promoted from the grade that I am to the second other grade, whereby I could take so that I could leave my friends behind and be able to take the school living certificate of, to go to college in 1973. If I hadn't jumped classes and work hard in that environment where schooling is not that important, I would not have been out. I may not even know whether I was alive, because passing that exam is what really puts me to be out of that chaos at that time, and to give me that chance of going to the medical school. So it was, it's also the school system also there it's been neglected for sometimes, and let's say that there are about 253 students who take this special exam. We usually used to have only 2 or 3 people passing it. And to think about overcoming that challenge, if I just depended on the system, I would not have been there. So I had to teach myself, and really trying to know what is there, not just by sitting down in classes, but to learn how to, research. I mean, there were textbooks, so there's nothing to research about it, but just to sit down and enforce yourself to get more than what you don't get at the place that you say is school. So, and for that, the community was very supportive. My parents were very supportive. So I mean, the thing is, a chance, having a chance for these kind of chances, they're not, you don't have them as something that you have them for sure. They don't come all the time.
So you grew up, you mentioned that your family, your immediate family, your extended family, your greater community around you. Could you talk about, to further describe your community and family around you, could you pick out a few people as examples of influences, or who you spent a lot of time with?
Well, we are such a freelancers. But I think, of course, my father was one of the persons that I would really appreciate because of the way he was thinking. To him, it's not always black and white, but it's really black and white. You work on something, you agree on something, you stay on that, and that's important because not to be stubborn, but at least to have parameters that you should always somehow follow if you ever want to move forward. Otherwise, you can just ping pong in your thoughts, and you can't go anywhere. So that decisiveness and saying that, okay, this has to be done, and it's done, and seeing him, going to tax, whatever, unit and say, you guys are not charging me enough, and I don't want anything. Make it the right way and do it. Those are the really good characters of him, although he can be very stubborn sometimes. But my mother was the opposite. She, everybody knows her in a special way, and she does not even think that someone does anything to anybody. So, having parents with two different characteristics, really, I can say I have a bit of both. So,
what would you say you take from your mother?
To be nice. To be nice and to be more, part of your community. Not to do anything for reasons, but just if you want to do it, not to get any kind of favors or anything. Just do it, and move on. But just be nice.
So your brother applied on your behalf to medical school. You said first in East Germany, or did he just work with the embassy? And
There was those days, and still now. The East European countries used to provide scholarship, few numbers of students per year in each country. So Czechoslovakia, Russia, all of them, they used to do that. And I think by the time he thought about applying, the only one that was left was East Germany. That's why he applied for East Germany.
Before we move forward in time, is there anything else you can think of from your childhood that supported you in doing the work that you did later?
Yeah, I think that mindset of the student movement of standing up for the weak, and is really very important. And because we were, despite what it could do to our family and to a lot of our people, we were fighting for lands to be given to those who farm. We were fighting against, demonstrating against starvation when the government was openly saying there is no starvation.
Could you state which years you're thinking of?
This is this is up to 1974, and starting from early 70s, this has been continuous, and this is right at the peak of where the worst famine of Ethiopia, before what I said earlier about that we are the world song, that this is really one of really serious. About 2 million people died out of and you could, even then, I remember when I went to WHO and stormed the WHO office, because not me, but as a student, but because probably we don't have to say this much, but because UN stands up with what the government is telling them, especially WHO. So it was really very disheartening to see a WHO representative saying that there is no famine in Ethiopia because the government was saying there is no famine. So it was all this fighting and fighting for the right thing. So that also was followed me when I was in Hungary also, because although the Hungarian government was friendly to the Ethiopian government, because that was the government that was established eventually was kind of slightly socialist government. So politically, they were aligning with the all East European countries, especially the communist countries. But despite that, and despite knowing that it would be very difficult to oppose and stand up for right, we stood up for it, and that's why I had to come here. I will tell you some other time, but there's stories in there too. But really, especially the last 2 years of Hungary also was not very easy.
Yemen was also communist at one point. There were
Southern parts of
connections,
Yemen,
right?
southern
I think
part
it was a
of Yemen.
socialist
Yeah.
state. In the south, is that correct?
Southern part.
So to get an even higher level of detail, I'm wondering if, while you were part of the student movement, if you could give a few examples of when you really learned to exercise resistance.
I thought that was just part of our blood. It was just normal. I think it was normal, especially for us those days, because, like I said, it started like back in early 70s. My brother went to college. Started university before me, like 4 years, but I think it took him 8 years to finish because it's a 4-year school. But all that cohort has always been, resisting, and we never really finished the school on time or finished the whole year. So it was always, that was the story of the Ethiopian student movement. So
Was it in the way that students would take time for activities outside of school or interruptions because of what was happening?
No, it was just. You can imagine. This is emperor. So, and sometimes things go a little bit out of hand when they try to disperse, and then people get killed and students get killed, and not to influence high schools and others, so they shut down the school, and then you come back after 8 months or 6 months, and it was just, and then we never had that thing of saying that, okay, I want to finish no matter what happens around me. So, it was like a collective, I don't know, you can make it craziness these days, but a collective responsibility that we felt had. Mm-hmm. And I don't think we have any regret about it, because that really, although the way it went may not be the way everybody has imagined, but I think it brought change.
Within the realm of your social life during that time, do you think that there were parts of yourself that developed that also contributed to your work later? Being able to work with people or connect with people?
Yeah, I think for that, remember, I left when I was almost like 17 when I left Ethiopia, so I was not. But I think there may be some in it, but I think, a lot of people have done that. But I think we also have a little bit, advantage based on where I grew up also. It's a city that never knew who is who. We all knew each other. We never knew which tribe you are in, and we, so it was really an open society that looked everybody the same. It is a kind of little bit, hot area, so, you never see anybody, you cannot measure him based on what kind of shoes he wears, because everybody is wearing the same sandals anyway. So, nobody puts ties because it's too hot. And so we grew up of just being equal among all, So it was no problem of, there is no hierarchy, and even if you want it. So I think that also had a lot to do with the way, I came out of it. And then it is a city that had all different tribes, local tribes, Somalis, Arabs, people from Yemen, people from all part, Greeks, Italians. I had, classmates, Italians and Greeks, who you never even think that they're Italians or Greeks, because that's them, So that was also a very good. The city is called Dredawa. And I think we got more out of being from Dredawa in addition to other things. So it has a little bit of we were different from any other cities of the country.
What about other cities that you've lived in later in life? Could you compare and contrast a bit about with?
You know, the irony is when I went back to Yemen in
96?
96, I'm talking about when I grew up in like early 70s, or, I had more friends in Yemen from my town than if I had gone back to my city itself. Because during the revolution, almost all of them were deported, and I had, I had more friends then than in my own city, from my own city.
How did you just run into people, or did you know to look them up?
You run into people.
Because you're out.
And then once you get, then of course, then the connection is that everybody knows that you're there, and then you start looking for your friends. So,
did you grow up speaking different languages?
In my city, you had to. You had to. You had to speak Arabic. That's where I learned Arabic, and I didn't learn Arabic in any Arab countries. I learned it in my own city. Arabic, Somali, Oromo, Amharic, my own language. That by 6 or 7 right there. That's where that came from, because it was really everybody was just living there together without even knowing who is who. So you just talk, and there was no, it's not like any other city basically. You would never know, because I don't know if you know that Ethiopia also had this ethnic issues.
I know a little bit.
But we never had any. There is always ethnic issue, but we never had any of that. Yeah. And probably that's what also I was able to work very efficiently in Somalia too, because this is both the Yemeni and the Somali experience also. It was not a new community or new society for me, because I grew up with it.
What other things did you know from growing up? Just, I guess we can also talk about that later. I was going to ask you what else you learned early on in life that helped you later. So I'm thinking about culture, customs, and like etiquette and ways of getting on with people that distinguished you as someone people could trust and work with.
Yeah. No, again, that is specifically, that city was a college for that. Like as I said, it was so many different kind of people that you live with. It's not that everybody lost their identity, but we all accepted the other's identity. So it was, when you go, when you interact with certain, nationalities, you respect what they have, they respect who you are, and in between, probably at some time you may create something new. But we never saw anybody in a way that I'm better or whatever. We all were accepting each other as just human beings, not even nationalities, just human beings. So there was no problem on how we look at anybody else. So it's not only there is no problem, but we also accepted what that community had. So this is the problem. It's not that this is my identity, but I think my identity at the end of the day, if you look at it, for those of us who came out of that city, it's like 10 different identities, all in one.
Besides school, where did you spend your time until you were 17?
School.
Oh, school. Got it.
Of course, during the summertime, we go from city to city as big cohorts of friends and families to be in different places and cities within our own, but it's cool.
So you did some travel too?
Yeah, we had. We move. Summertime you can't just also sit. So So what happens is every family comes together, and then we move when I say by moving, of course, my uncle is here, the other uncle is there. Somebody may have a big farm, so we go spend time there. So we were together, so.
Who were some of the family members you would go?
It is
move
by
to see?
cohort.
Okay. Huh.
It's by age.
So all of the 9-year-old kids would go with one uncle.
No, we all go together to one uncle. Yeah, that's correct. And the same thing with the girls also, wherever they feel comfortable, they all go together.
How large a group would you move with?
Sometimes it is up to 20, 30.
That's a big family.
Sometimes I remember at the house, when you wake up, it's like, there's not even bed. You can't build so many beds. So the people sleeping like, in a row as if it is a jail or something,
There's plenty of room.
But that was nice.
Anything else about your childhood that you are thinking about right now?
I think that's okay.
Okay. If things come back later, we can include them. So you went from Ethiopia to Budapest to go to medical school. Is that correct? And it was Semmelweis University of Medicine?
Yes.
Could you talk about those years a bit?
Well, I think I really like Budapest a lot. It's a very nice town. It took us 7 years to finish. That 7 years includes a 1-year language class, because in the university, the language that we used to learn medicine was Hungarian, which I have never heard before, even the fact that Hungarian language even exists. So they have a very good preparatory school that really prepares you to be able to just be thrown into a huge university and just start, working in Hungarian. So that was the first year. As I said, I was in a medical school, which is really, I think the first years are a little bit difficult because, I think it was good that we know some of the Latin names, because it's not, they didn't come up with any new name for any part of bodies, but I remember we used to have English Hungarian, and then a dictionary here, so 3 different. But as time goes by, I think the one thing I learned is really you don't need to learn language for ages. You can, if you take time and have appropriate way of learning it, then you can do it in 3 months. And Hungarian language is supposedly one of the most difficult language. But I think as long as you're speaking it, it's not difficult. But in 3 months, we already started to learn biology and chemistry. So it's
In Hungarian. Wow.
So from there, it's medical school where there is no undergraduate or graduate. It is medical school. So the first 2 years is to learn the basics. What I mean by the basics is the anatomy, the physiology, the biochemistry. And usually those are, and those are the especially finishing or getting through the second year is the most difficult, because by the end of the second year you have to, answer to all of what you learned in the last 2 years. It's not subject by subject. The peculiar thing there was, in that 7 years, that I have never taken a written exam. All exams was interviews. You go in. You may have like 2,000-page books that you need to study, and you go in and then choose, take a card where certain subjects are on, and it's not 1 or 2, but it could be whatever. And you just have to answer it from whatever the professor asks you. And he will judge you in the way, the depth that you know the subject.
How did you do?
I was very good at it. I just, I think the problem is, a lot of people get nervous, but for me, it was, what is it? You just go sit in front of somebody who's asked you. If I know it, I know it. If I don't, tell them, look, I know you asked me about King Solomon, but I can tell you about King Abraham, so let's talk about King Abraham, What's the big deal, But no, it was, it has its advantage and disadvantage. You can learn everything, and then you may leave 2 pages, and if you're unlucky, you pull that page out. But this is thinking of how you measure knowledge. If it has just allowed you to have interaction, and then just your professor just tries to understand how you understand it, rather than just you or somebody just memorized it. And a lot of people used to do that. It's then, what you get out of the memorization is not something that would stay anyway. So if it forces you to memorize, then that's not good either. It was interesting.
So we were talking about your time in medical school in Hungary, and I guess we could broaden that even to your early training and career. Again, experiences from that time that contributed later on.
The one thing I vividly remember is when I was in medical school. If you just take within my training, is that, smallpox, the last case of smallpox in the world was in Somalia and in Ethiopia, and the Somali region of Ethiopia. Because, but the last case was in Somalia and Ethiopia. And this sentence used to appear during our medical education so many times. So you just say, it's really kind of black eye on you, last case of a smallpox in Ethiopia, in Somalia and Ethiopia. That really also left with me a bit of that, if anything comes next, that place should not be the case. And when I went to Somalia to work, I went with that vengeance of it will not be the last place again. But I think, I may tell you this, but I think the finishing of a school in Hungary was a little bit more turbulence than one would think. We can say that when I graduated alone. And because based on the agreement between the Ethiopian government and the Hungarian government, number one, our diplomas will never be given to us in Hungary. And number two, when we finish, we are allowed to go only through Moscow to go to Ethiopia, so that we don't go anywhere else. But for me not to be in that situation when everybody finishes, I did not take my summer vacation, so I started my internship much earlier than others and finished my requirement before anybody knew that I finished. And that's how I had to, and the diploma also, I was not given original diploma. I was given to toast with the diploma for 10 minutes, for half an hour, and God bless the American embassy. They took the picture of it and then notarized it. But my original one is with me. So it is with the support of the American government and the UNHCR that I was able to come to land in Germany. And in Germany, I waited for my refugee process to be completed, and that's how I ended up, where my cousin was living in Los Angeles. So the last few years of school there was not really very was not a good experience. you could see how sometimes even, okay, of course, we were opposing the government, but how sometimes, governments also, if they want to follow you and make your life miserable, how much they can do it. Because I had new roommates, new classmates, my car confiscated, all of these things because of being on opposition side. So,
what was the first contact you had with the government? How did you know that they were coming after you?
We were open. We were not saying, we were not hiding our opposition to the government, but we were also openly criticizing the Soviet Union and their other countries, because we were saying, and for Hungarians also, because the Hungarians were selling buses to the government, and we're saying that you are kind of aligning with a government that's not to be aligned with, and we were telling them on their face that they were doing just this for economic gain. So that didn't go well with them. Yeah, and then the nice thing about it is is when I went to Germany. I kind of say that I was kind of high-profile refugee, so I was given a chance by almost all Western countries for me to go. And then, really, I chose to come to the United States for what it is.
What is that?
In addition to what it is and what it is not. By that time I was tired of history. Every country, the same thing even with Ethiopia, we keep talking about 3,000 years of history and this and that. If you go any place where the place stays that they have history, and it would be very difficult for anybody else to come in who was not part of that history. So, I'm not saying that the United States doesn't have history, but it's a young history that is being, made together with everybody else. So it's not like sitting in Sweden or in Germany and you have to fit in.
What were your expectations of the United States when you chose it?
You can do what you want to do. And it is not a place where you can also lack, because I can see a lot of my friends who are in Germany who were just given things that they can just live on and can just live on, and they are not pulled towards really doing what they need to do. Just stipends for them to just live on.
Live on, you mean
just
kind of coast and...
Yeah, cruise living with no sense of, future or anything like that. And I remember, when the counselor told me, look, now we saved your life, but from now on it's up to you, it's all you. So that's a good thing.
What was it like to hear that?
That was good. And I say, I do not expect you to, I said, thank you for what has happened. So from now on is all, I have to make that happen, whatever comes from there.
So what happened next?
So that's when I started working in LA, three days a week, 12 hours a shift with dialysis until I finished my school, my exam.
And then you went to UCLA for a master's degree in public health.
Yeah.
Okay. At that time, what was your mindset around public health and what that meant to you and what you imagined you would be doing?
Yeah, that's very strong too. While I was in public health, the issue of HIV had started to come up a lot. And from then on, I said, okay, now I need to mix the public health with medicine, internal medicine that I wanted to. I always wanted to be a nephrologist, by the way, after I was working in. But then I could foresee the devastation that would come in Africa with AIDS. And that was really what I was preparing myself for. And when I went for internal medicine residency also, I was in Harrisburg. It was it's a community hospital, and I was the first to actually establish. What I mean by community hospital is a hospital that is not used to or accepting, some of the reason of why HIV/AIDS is there and stuff. But I established there, of the first outpatient clinic because we just always been, inundated by not being able to care for AIDS patients, and then they come at the worst time. So
what would you do? What was the protocol when someone would come to that hospital in Harrisburg?
No, I mean, if you come for admission, then there is no protocol. I mean, you just admit like anybody else. But what I convinced them is, let's not wait until whatever they think why somebody would be having, why somebody may be infected in HIV, but whatever it is, it's not the right way of doing it. At least let's have, outpatient clinic where they don't have to, and nobody has to wait, whether it is HIV or whatever, until crisis comes in. And that was very important for few things. It has led me towards saying, okay, I want to do infectious disease, and I want to work in Africa in public health. So I applied for infectious disease fellowship, but I couldn't apply.
Because
the director of internal medicine, who was an infectious disease specialist, flat out told me that he will not sign for me any recommendation unless I apply to CDC or NIH.
Did he like you?
Yeah, I mean, he said he would, and he swore, and he refused, and by the way, I was also acting as the chief resident, but he refused. He said, you're not going to infectious disease fellow before you go to CDC or NIH.
And why? What was his reasoning?
As an infectious disease specialist, I mean, he sees that, everybody in all universities, everybody went through the AIS class. And he felt that, if he missed something of not being part of that clique of EIS graduates. And
so that's how you ended up coming to CDC for EIS.
Yeah, so I applied for both NIH and CDC. And NIH wanted me to do infectious disease and oncology at the same time, working on HIV. But I had to tell both of them, look, you got to tell me in advance because I don't want to miss the whole fellowship of infectious diseases. And luckily they were nice enough. I was accepted by both. Then I went back to Whitecamp and I told him, okay, now what do we do now? Now he said, no, go to CDC, not to NIH. Because NIH is not your type. CDC is your type.
What do you think he meant by your type?
Because NIH is research-based and all, and you have to work on your own and then write up on your own. But CDC is really a community of scientists who like to work together. And that's interesting. That was interesting. And of course, I never went to infectious disease fellow. But then I did my EIS was in fungal diseases, because fungal disease was one of very common opportunistic infections during HIV, HIV infection. So that's why I did it in fungal disease. And that's why exactly I also went, after I finished my EIS, to work in vaccine adverse events, because that's what eventually will help, looking forward for development of vaccine in HIV.
Is that when you met and started working with Steve Kachi?
Yeah, right before that, I worked with Bob Chen.
Because you came to CDC for EIS in 1991.
93, I joined the vaccine adverse events. 95, I joined polio. So as time went by, then eventually, of course, my aim was really to, again, based on the desire to work in HIV and its vaccine development and vaccine. But then, then came Bob Keegan and polio. So,
how did that come about? Well, first, could you talk about the reasoning for your interest, the reasons for your interest in AIDS?
Again, it's a massive public health burden, and knowing what could also, again, going back to Africa also, is knowing, how much disaster. I mean, I saw that, before, really the numbers came out, how much of a disaster it would be based on, public health education, public knowledge, the way people behave, and it was just written on the wall that, it's going to be a huge impact on lives and I mean, millions and millions, and I knew that was going to be a big issue.
Was your intention to go back to working on the continent of Africa?
Always. Always.
So you said that you were beginning to pick up with polio, the polio eradication activity, and meeting Bob Keegan?
Yeah, I mean, before that, I mean, there was this issue of what they are, because we were neighbors, when I was doing the vaccine adverse events. And I see them, they come for meetings. And
who was your boss in vaccine adverse events?
Bob Chen.
Okay.
And at that time, I was also going out while working with a vaccine adverse event. I had communication with some Ethiopian friends and, Ministry of Health. I just saw them struggling on re-establishing the basic surveillance systems and everything that you can think of, especially in surveillance. Because there was it sounded like the cause is really noble, and the idea looks very effective, but doing it was not possible because you have, deciding on what disease to include in this surveillance system, because they call it integrated surveillance system, and how to manage each and every, specific disease data, who will work with you. It's just an utopic wish that unless you have someone who really bring all of these people who are managing these activities in one bottle, not in one room, that they can come up eventually with something. So with all the good idea of having, an effective, an efficacious surveillance system, no one just could ever bring it together, because. And then comes polio program that at the end really gives a very clean and clear goals, performance indicators of, and then that covers, its implementation covers all the different aspects of what, you could do in surveillance, training, supervision, logistic support, all of these things that we've been crying for was in one package.
And it had been up and running for 2 years at this point.
They were discussing it. It was not up, but in one package, but not only in one package, but also with funding, which makes a whole lot of difference over everything. So I thought, even to have that impact of what I was looking for, if I just wait for this, big integrated system to start up. It will take time. So why don't I go into this polio where there is money, but it all depends on how we shape the programs and how other programs will benefit from it. So that's how I convinced myself, in earnest, not just to do a job, but in earnest, to use it to support other programs.
So you became a medical officer for the polio eradication activity. Who did you work with most closely? Actually, besides what you just spoke about, or in addition to that, could you talk about the opportunity arising? Was there an opening? Who approached you?
Yeah. Before I joined, I did few consultancy for UNICEF in vaccine adverse event issues. And then they followed that with, they asked me to go to Yemen for just consultancy to look into the EPI program, EPI meaning routine immunization. And that's when I wrote that report that, everybody said, okay, open their eyes. And but based on the discussion that we then, going back and forward with Bob especially, he was happy eventually when I said, okay, Bob, it's time, okay, let's go work.
Could you talk about that report a little bit that you just mentioned?
No, it was just a very honest and straightforward, but detailed enough report that tells things as it was and what needs to be done.
And that was part of the vaccine adverse?
No, that was just a review of routine immunization program in Yemen.
Before
I joined polio.
Okay. Yeah. So you say to Bob Keegan, it's time.
It's time. Let's go work.
It's time.
I don't know how much he was into it, but I think he was excited and say, okay, like the first plan for me was to go to work in Egypt, Alexandria, and I went to the WHO office and sat down with my, Dr. Wahdan, who was very prominent and a very, someone who really has all his heart for the regional office and knowledgeable, but he was running the polio program. So he was just not convinced that we need anybody there or anybody in the region. So then he asked me, okay, write a terms of reference based on what you think is important, because the aim was for me to go to Alexandria. So, I just sat down and looked at all of the problems that they had, and I think, of course, at that time, Yemen comes up always lights up as a place that no one has any, information about, the trust issue between the country and the region. It was just like non-existing. Everybody thinks that you cannot do anything in Yemen.
Could you explain more about the relationship between Yemen and the region? And
in the eyes of everybody too. I mean, not only the region. I think Yemen is one of, I can say, not directly saying democratic, but the most open society in that region. You can say that the tradition has never changed.
Even though in the South.
Well, yeah, I mean, the South are, those days, the South, even now, the South does not really reflect in anybody's mind of what Yemen is. When people talk about Yemen, they talk about the North. So it was a place where, there is a joke that says, if Adam was brought in for a visit and he was taken around in the whole world, he will not recognize any city. But when he reaches Yemen, somehow he says, that's Yemen. basically things never change. It's really they are very open. They are very honest. They have nothing to fear to what they want to say. You know, it's a very traditional society, and they have their own ways of doing things. And if it does not fit with somebody sitting on the other side, so what? And because of their tradition, also a lot of people also think them they are a little bit behind in what we think is forward now or developed. So and they know it, and they acted that way, but they are no different like anybody else. So if you go, since that is the case, the way everybody perceives them is that they're a little bit behind. They are superly traditional. They don't care, and they're just filling the space, meaning that, to them, it doesn't matter whether it's a year or 10 years or 20 years, so they don't care if things change or change. And that kind of interaction, especially in the field that I was working, was a problem. So they could never trust anybody. So you come, you say you do, you go, all right,
In the field that you were working in, you mean as in WHO and CDC and public health?
Public health, the same thing in all other fields also. So that's the thing, they say, the feeling on a lot of people is that the numbers that we see is fake. What they are telling you is not right. They will just play, all these negative things. So. And it's not worth to go there and waste your time. That's the thing. And it was not agreed that I should go there.
How did you end up going there?
I say I'll go there.
Why?
I say, well, let me go there and then we will talk later on.
But why? Why? What motivated you to work in Yemen? And I'm going to ask you this about the other countries you've worked in too.
Well, to begin with, I like challenges. So by itself, even if it was sitting in another planet, Yemen was a challenge at that time. But it was good that it is someplace that I know very well, not far from, even if I take my kids, not far from Ethiopia, where they can just, even for them to get closer to their, But although since they haven't gone there that much, but for me it was that challenge at a place where others say that you cannot do much in.
So you were just discussing the perceptions of other people of Yemen. How did those perceptions compare to your own knowledge of Yemen and Yemeni culture?
They were normal people. Normal in their context of their own, where they function, they're normals. Nobody is out of line, who is anybody else to tell them that they cannot do? You can hear jokes about them, but. And one thing I did was I told them when I went, I said, look, don't spend my time either, I came here, to eradicate polio, and they asked me, what do you mean by that? First, we discussed, what is the problem?
Who? You and who?
The immunization team and the Director General of Health and all of these people who are at the ministry.
In Yemen.
In Yemen. And, it was the same thing, you can't do this, you cannot, and then, of course, you can see how things are working, and they say, of course, this is not going to work anyway. But is to say, what makes you different from others? Why you let others to see you different from others? But I was, concentrated on also eradicating polio, and the time is clicking good. At that time, they were almost the last country in Asia that ever done campaign. So, why are you in this place? Why are you the last country in Asia? Why is it that nobody? And then they asked me, what is it that you want us to do? give 2 drops to every child. No problem. What do we need? Well, okay, we come back to what we need, but then, so we didn't discuss it by saying, okay, this is the plan that I brought with me. It is, okay, this is the vision that we see, and this is your call. But you should not allow yourself to be seen as a country that cannot do. And they took it seriously. But then the problem was convincing others that they took it seriously. Because it still was, there was no confidence that I went to August and I wanted to campaign, September. I wanted to campaign in October or November.
Why?
Because the time was ticking. And our goal was 2000. And you can't, and then, if you start also with just, slowly, then things will always be slow anyway, so. But, but then the first almost like 30 days, all we were doing was myself and the director of immunization to just sit and put the data that they have in the computer. I mean, they have data such, they know that the distance between 2 villages by how much time everything. And
what was this person's name?
Ahmed Said. And he was just like an encyclopedia in his own. And
how long had he been doing the work?
Huh? Him?
Mm-hmm.
He'd been there for a long time.
Like 20 years?
Well, long time anyway. But since it's a director position, I don't know how long he was in place. But so it was clear to me that and then we came up with a micro planning that has never done in other places. Like, other places you just divide the number of children by how many child a team will immunize and say, okay, I need this many vaccinators. But with him, when he showed me all of these, different aspects of how to operationalize things, then we did it a reverse way. Then we took few things. If it's in a city, you don't need much cars, or if you are in a desert, you need a lot. So it was not just Excel planning, but based on certain assumptions, we came up with different parameters of how we distribute the funding.
What were those?
Basically, it is what kind of area you're living in. If you are living, if I want to immunize, 500 children in a desert area, it should cost me much more, or it will take much more time for people to move from one house here to another house, which is like 2 miles, compared to immunizing children, like so. So that if I want to have a quality work, I have to take account of those. I can't just plan for this many children, this many vaccinators, and give it the same for everybody.
Was that a hard sell?
It was. I mean, we are the decision makers in the planning, so that was not the problem. But the problem was that we could not move anywhere because the region was saying, you can't do this campaign.
The WHO region was saying that?
Because they say, we know them, you cannot do this campaign.
Mm-hmm. They just believed it was impossible. When you volunteered to go to Yemen, did you think of Yemen as a challenge? What were your perceptions?
Yeah.
And what were some of the challenges that you anticipated?
The fact that it is still not coming up with appropriate level of immunization, the problems in work ethics and all of these things that really, they just do it because, I mean, if they don't do it, they don't feel like the world will, be over. It's okay. We didn't immunize children, so what? So, So I knew that they didn't also have that kind of thinking of this is a must thing to do.
So there wasn't a sense of urgency.
For all the things, they don't have sense of urgency.
What
I mean, it's not they don't have sense, but they have certain things that they believe in, which is. But that doesn't mean that they do not do what needs to be done.
Sure, sure. On the topic of work ethic, could you describe the Yemeni work ethic?
It's not the work ethic. They have this habit of, not habit, I mean, my grandparents and my family also used to do that. There is a session in the afternoon. It's called chat chewing. Chat or cat.
Khat?
Yeah, is a leaf. It's amphetamine-like leaf that it's not, the origin of it actually is my own town in Ethiopia. It is eventually it gives you that sense, but I think it has a lot of significance in that society because it is. It used to be utilized during wedding, religious ceremonies, and so people can sit and pray. But as time went by, it just became a social event where you could sit with friends, usually Saturdays and Sundays or weekends. But eventually it became almost every day. So you will not find in the afternoon in Yemen a shop that is open or an office that is working. So, unless you have special interests in what you do and you go back to it in the evening, if it is something that's supposed to be done at the office, why should you go back and do it? It's gone. So I mean, that was one of the things that was actually, a lot of people think was detrimental for Yemen, but to me, it was not. Because I used it to really utilize all of the assets that the country had to be put on it.
We could talk more about the assets of Yemen and how did you use it as an asset?
Because if, it is how you start sitting and having the session. If you sit on a session, for a session, with certain aim that you want to achieve, you will be so concentrated on it that it is really, it does not go into some of the negative effect of drugs, but it's like, like students in the school, how they sit and, so that's one, but also it brought everybody at one place. Not only in my house, but every part of Yemen, every EPI or immunization workers were sitting together, sometimes until 4 a.m.
Probably good for team cohesion.
No, it's good because what we could have come out in planning like 3 months, we can come out of a plan as detailed as it is in one day because everybody's, feeding into it.
So just to state it explicitly and concretely, could you talk more about COT and what it is and what its effects?
That's not fair. That's not fair because it makes me no. I mean, I say it's not fair because what it does today in a lot of societies is really very, very bad. It has left a lot of children malnourished because their parents are spending more money on the cat than on. It has left a lot of generations just to sit and do nothing. So in that sense, I cannot talk nicely about it. But it also has an effect that, if you look into how it used to be used in the old days, where it is for a reason, it is. I mean, now everybody may say that, okay, this is the culture, but it's not a culture. It is a learned culture. It's a brought-in culture, so it's not a culture. I mean, the fact that if you look into what it did to Yemen, specifically, is like I said, the problem was we go to work in the morning at 8 o'clock, and by 9:30, by the time everybody stopped shouting, and then 11 o'clock, you have to go home. And the guard comes and tells you, get out, because he also wants to go and have his own, buy his own cat. So what do you do, I mean, even the parliament used to have the same problem. Huh. But the only way they also used to follow it up is by sitting, in cat session, with the problem that there is nobody who will take notes. But but they discuss it and they finish their issues. But it is you will never see a session in a parliament that was completed.
Wow.
So I mean, coming back, so when we did the planning, in the meantime, once I got some support from Bob and Rotarians to move forward, one thing I did was I established what we call interministerial body, where all ministers were sitting, and they come together only for polio.
Where would that happen?
At the Ministry of Health, and the chairperson of that was the then vice president, by the way, who was a current president, but at that time he was a general, military general, experienced, with his main activity in military operation.
Sounds like an asset.
Well,
okay.
When in that meeting, when we showed him the microplan, because of all his operational mindset, he said, wait a minute, and he went into the minister's office, and he came back and he says, okay, I want to lead this. And from that day on, because he sees that he took care of all of the little thing that, that an operation should think, and he really took it on his shoulder and made it his leadership is that brought all of the ministries, together on the same table.
How many were there? How many ministers?
The most important was the information, the finance, the religious, the welfare, all of those ones which we needed to be engaged in the field.
And then he led
the information ministry was, okay. The advertisement on polio that used to come out of the TV, people started saying that they will stop even putting hooking their iron into the electricity, because if they put it, they probably will start saying, something about polio. But there is a very interesting story. We by working with people, we were able to really carve out timeline on when the commercial come.
How did you choose?
The thing is as much as we could, and we could get as much as we wanted. So in one of these interministerial meetings, so now he started giving direction to all of the ministries. But before that, we were already arranged for that. And then after that, the TV just completely stopped doing anything on polio. So me and the head of communication rushed to the TV station, and we asked, what's going on? The vice president, he said, you know what he said? He said, okay, call him and tell him to push this button. It was me who was pushing it for you. And then now you come to me through the vice president. Okay, say, okay, come, tell him, You know what I mean? So this is the kind of mindset that they have. You don't have to have big power. On every chair you sit, you are powerful. Then okay, so we said okay, we're sorry, and then he put it back the way it was.
How long a time frame was there no polio messaging?
Oh, it was like we were just usually it used to come minimum half an hour. Sometimes it comes every 10 minutes. I don't know why, but the whole afternoon or the whole day, there was nothing.
But it was only one day. It wasn't like 6 months or something like
No.
that. Okay.
No. We rushed back. We rushed and went. And then I want to tell you a story about that also. So I'll come to the details of how difficult it was, but we eventually were able to put together a campaign. And that campaign was what you used to call a fixed post campaign, where people come to health centers or schools or whatever, and get immunized and bring their children. And it was really amazing because of all of the commercials and the spots on TV. Children were being brought in a trunk of a car because there was no space in the car itself. That was really amazing. We do 2 rounds. We do 1 round and then we come later on, 4 weeks later, another round. So that first round was so successful. It was really amazing.
Was that November?
Sometime, yeah, November, the first round. And then now we all of us have this fear now. Can this be repeated? So would people still come out and be immunized like this? And that was one of the things that everybody was saying. In Yemen you could do it only once, you cannot do it twice. But you have to remember now, at first everybody knew that there was in the health centers immunization was given. Nobody knew that immunization fixed points could be in the school, could be in your neighborhood. So when the second round started and we went back, the same health centers that we went the first round, it was like 1/4 of what was there, yes, the first time. So I said, this is a disaster. Okay. So again, we ran to the TV station, and then we told them, and we begged them, please come up with something that just come out as if this is the end of all of us, unless you don't immunize this afternoon and immunize your child, it was amazing. So the TV commercial were running until 10 p.m. All health centers were sending us fax, please stop these TV commercials. But we got more children that day just by that one act. It was.
What do you think it was that motivated people to come besides their own health? Was it really the power of television?
The power of television, But, I don't think anybody has ever used television like I did, especially in Yemen, because, the time was very short. By the time it took to do this cascade training, it was very short. We trained the whole Yemen volunteers live on television because we didn't have time to go train block by block. It has never been, I don't think anybody has done this, but we train everybody because we didn't have time. But to find, they gave us time with kind of, pre-advertising of, if you are a healthcare worker, you must watch this day. There is a training that you can never miss. It was like, if you pray and finish it before the training starts. And so we really train everyone at the same time on TV.
So the trainings that occurred on TV, live broadcast, this is what you do?
Yes. What we would have trained in a health center, like going, sending out people to each and health center, was done on live TV.
Amazing. How many people do you think were trained in this way?
Everybody. I think everybody watched it. It's a live TV. It's on prime time.
Like in your own home, people in their homes watching TV at night?
Yeah.
Wow.
So those are the kind of things was really,
What else? How else did you do it?
Well, the other part was just convincing them that, they're not less than anybody else. They can do this. But also, it was right before an election. So we went in and somehow interjected it, that any party that will be aligned with this campaign is on the right side. So eventually we had, so it became in the kind of manifesto of that party for that running for the election.
So there were candidates who were championing.
All of them, not only one, all of them. The problem I used to have is, for inauguration of the campaigns, who to accept and who not to accept, when and what, this party, that party, the prime minister, the president, where should I send them? Where we should send the minister? That was the problem. There was not a problem of can we find someone to inaugurate? They were falling on it like nothing else. It was the thing to do.
Great for polio eradication.
It was the thing to do.
So when would you say that campaigning was happening? How many months into your campaign?
3 months.
Because polio was eliminated in Yemen within 3 years, you said.
Yeah. I mean, we have never seen anything that looks like polio. So 3 months, 3 years. So I said, okay, now let's go. But in addition to what they have done, because what we've done is through this, we brought in the community, the religious community, the tribal system, all of these different parts, the parliament. I mean, one of the reasons that we don't sleep like a day or two before, because is once the campaign is out, and the reason that people stay until 4 o'clock collecting data is that's the first operation room. That operation room is open 24 hours. And the goal was to collect all data within 48 hours of the campaign, whether you are up in the mountain or whatever. So by the third day, we used to go and present this to the parliament. So we shocked the parliament and by how fast that program could bring in information like this. Then eventually we were also able to put in, because when I was there, Yemen was not paying for anything, nothing, for vaccine or anything like that. So because it was so popular, that, we were able to bring in the budget of routine immunization with incremental, increase to be in the national budget, in the parliament.
So the funding was coming from Yemen itself.
It started to, because that was the only time that it has ever came to a parliament to be discussed, because it has such a good reputation of what it was doing.
Would you talk about where the vaccine was coming from and who you worked with at UNICEF to get vaccine?
Well, I mean, the vaccine, there is another, special story about the vaccine. First, it's because the dates that I put was just too close for everybody, but it was not to me. So when I talk to Bob and I say, Bob, we must have these vaccines, and we agreed that he will go and ask for a special donation, emergency donation from the Rotarians. Because, okay, let me go back. When I first went to, I wasn't working in WHO. I was working in WHO. When I went to UNICEF, there was a UNICEF rep by the name of Carl Tinsman. Now, he saw my previous report and he said, why is CDC sending you here? I mean, what do you want to do here? What is it, you know? So and I told him, look, it's not for now. We're doing polio eradication. He said, what is polio eradication? I said, yeah, we just have to immunize every child under 5. Every child under 5. He said, we've been trying to immunize children under 1, and we've been having trouble, and we could not even reach 1/10 of them. And he says, in how much time? I tell him, in 3 days. And you know, he thought I was really out of my mind, and he says, when do you want to do this? In 2.5 and 3 months? And then he told me, okay, get out of my office. Because I know you're going to come to me to ask me to bring a vaccine. I'll tell you, get out of my office, because what you're talking is just not possible. But you say, don't ever think of asking me to bring the vaccine. I went out and then I came back. And I came back to the office and I said, okay, what if I find you the money? Because I don't even know whether there is money or not. He said, you cannot find me money, at the time of like this. Now I say, what if I found you, like, if we find money in 2 days? And I assure also that Copenhagen can get you the vaccine in 7 days. Would you go with it? So he said, I know it cannot happen. Okay, you know. So we were able to get the money. And we were able to really schedule for him for the vaccine to arrive in such a short period that then he said, okay, I give up. All right, what do you want to do? So from that day on, really, he became one of the most important, polio eradicator. And so from there, that's another story, but from there he went to South Sudan. And the day he left to South Sudan, he asked me, what do you want me to do? I told him, do campaign. And he said, Elias, what do you mean? South Sudan, there is starvation. He said, just do campaign. So UNICEF was the agency that was bringing in for us.
Bob Keegan, in his paper that I believe is titled An Informal History of Polio Eradication at CDC, talked about difficulty with communication between the region and CDC, and I believe he says that you made special arrangements. So I was wondering if you could explain how you communicated with Bob Keegan at CDC from your post in Yemen.
The first one was this actually basically accepting that we can do campaign. Because if you don't, there is no acceptance. You cannot order vaccine. You cannot do a lot of things. So their viewpoint was, it cannot happen. So why bother? Okay, so we got the vaccine through special emergency funding by Rotary International. So that was we brought it despite the wish of the regional office, and I was just working with the government then, whatever, if they say it works, it doesn't work, who cares, we just need to immunize children, and never waited for acceptance from the regional office, although it would have been nice because it will help in a lot of other things, the budgeting and moving things along. Then there was another big problem because when I arrived there was no single surveillance system that is functioning. There was no AFP did not exist. There is there's just no surveillance. And I know that, because I see them, I know that the number of polios that are being reported, they were reported based on a form that everybody has to fill before they get their salary. So I stopped those reports, and then, regional office is saying, what happened to the surveillance? I say, what surveillance are you talking about? So I said, look, no, we're not going to report this, but we will establish a surveillance system using at least one, training people. But for that, I said, I need 10 people. I budgeted it. I submitted the budget. What I mean by submit the budget is submitted to the global community. We had we have a meeting twice a year where we submit what we need, and it was accepted. But then, again, regional office says, our policy, since we don't know what they do, is not to hire anybody under WHO contract. So you can't hire.
So what did you do?
Bob Keegan. I budgeted it just kind of bare bones salary, no nothing, no insurance, no nothing, And I said, put so much so much amount of money in my bank. So I was paying them
Directly,
which was very dangerous. I mean, okay, it was a good thing to do, but I could not. It's not the kind of way of that we could also provide insurance and anything like that. But we really jumpstart that surveillance, from that fund that Rotary has put aside, which I had to account for. It's not like but it was direct hire.
what was the risk of being the means of disbursement?
The means of disbursement is no problem because you just put it in the bank and you sign a check to somebody, so it's no problem. But I think some of these people were also working for agencies like UNICEF and WHO and other things, and they had to leave that and come. And when they did that, that means they also, kind of left some of the benefits that they receive, including insurance. So it's just very difficult just to understand that. Although you appreciate their effort, but what can you do? You got to do the job, but you also got to,
What motivated them to come work in Yemen?
Motivation. I mean, just the fact that they know that we are on the right track is something that they need to do. I mean, until today, it's really. It became like a family, but a vision of the country to do this. And those ones who were working in it were really thinking that they are really the vanguard. No, not the vanguard. The ones who really started this. Usually, always, immunization workers have a cadre feeling among themselves. But really, that really brought, because the success was to them also was just such a, and it was a clear and clean effort. There was nothing, no games, and they were all committed, and from the government all the way down, everybody, it was good.
So within the first 3 months, at what point did you need the emergency vaccine? How far into the campaign?
Oh, we need to have that like almost 2 months before, and this is the first thing that after we did the microplanning. That's the first thing that we went after.
Mm-hmm. So the microplanning, was that done in your house? Okay, could you talk about the role of your home in polio eradication and immunization?
Yeah, Yemen is a society also that believes in polygamy. At least men can have 2 wives. That means the house that they're building also has to accommodate 2 wives. Meaning it is not a 1-family house. It is, even if it's a building, it has to be a 2-family house with everything replicated for 2 families. So I told my wife, I'm sorry, yeah, I know it's for two families, and I'm not going to say I'm going to bring another wife, but I'm going to bring my other family. So we took the main house as really, truly, office. And it was where all planning, all discussion, everything is done. The reason is because of what I said earlier. You just couldn't work because everybody leaves at 11 o'clock. But you can go to somebody's house and you can sit with them chewing, and you can work with them. With them too. That's how sometimes I get out of the house, not to go anywhere, but just to go to the minister and sit with the minister and discuss work. So why don't I just bring all of them, in one place. So it was really, it was the other good thing about the chewing ceremony in the Yemenis, like what I've told you in my town radio. There is no hierarchy, especially during the chewing session. Every place is an open door. So you don't say the minister is here or the prime minister is there. Everybody can come and join that session. And it's very good. You have the minister, the finance guy on your other side, the minister on this side. Everybody else is also working in front of you. They have a question, they ask him. By the way, there are different stages for chewing. Huh? When you start, everybody is talkative, and then as they chew, you become more calm, and then you start really just working. From then on, it's just concentrating and working. So all of the discussion happened on the first phase of the chewing, but then as you move forward, it's just producing. And I had very small printer and a computer, they used to call it laptop, but it was this big. And just keep printing the memos for the minister. He just has to sign, not that he did not know what he was signing, but it is just so convenient. Then I was not only working, I was not only helping him in polio, but I was also doing other things for malaria and stuff. But to get all of those things, all of the release for funding, and your finance guys on this side, your technical guys on the other side, it would have just taken even 2 years would not have been enough.
Because of the waiting.
Yeah. And then when the campaign starts, it changed to operation room. That's all where the results come in, and and we also have close by another operation room. So by third, fourth day, we're done, and then rest for a few days, and then start all over again.
How did the work environment of your house change when you moved into operations?
Always noisy, the kids could tell you, they knew everybody, and my wife had to go through sometimes a lot, but.
But in terms of staff and who was there?
Everybody who was working in immunization had to come. There was no staffing. There's no, okay, can you come or you don't come? But I tell you one story. Carl Tinsman, the one who I said was UNICEF rep. We also became family friends, and he used to come in at night sometimes. His wife and is also from Ethiopia, and those we were, became close. He was so sorry for me, so one time he hired me a data manager. Just, I'm WHO, he's UNICEF, so why should he hire? But he said, so it was, well, yeah, those good days. So the bottom line there was, is okay. Before that, I want to tell you one thing. There was a British man, somebody from England, who was sitting in my position, who eventually also had a very high position in global immunization in Geneva. He was there for 2 years, and a lot of my friends in the business was telling me, even him could not do well. I mean, why would you go there? After a little bit of working with them and became just, colleagues which open up and discuss everything, I asked them, I said, why did you leave that man working for 2 years? And just, and you have no interest in what he does or what he gives you, and make him suffer here for 2 years. And what they told me is very, kind of in its own way, very powerful. They said, we gave him an office, brought new furniture for him. And you know what he did to us? They said he put his wife's picture on one side and his daughter's pictures on the other side of the table. To them, for that culture, it was just a shock because, there was no woman that you would see walking, with an, So, he said, how dare he really, tell us, do those things like that. But they have never discussed with him on what that culturally means. But somehow they just cut the cord between them and him and just say, okay, he comes to work at 9 o'clock and he leaves at 11, whatever time. He can do that for the rest of the 2 years. But, you know what I mean? So not understanding each other culturally, and a very innocent thing can take you out of your way. At the same time also, knowing and being part of that society and community can really take you far, far, far away from, to far, far place where it would not have otherwise been reached. And I think my working with them was, it was the latter.
Do you think about your role as having had a balance to it? And how would you describe
What is balance?
Balance between being an insider and also, to me, thinking about...
No, there's no balance. I think what I knew and what I said and what I always say is I go to these places to serve. And I am not trying to, and with the goal of really reaching every child. If a government or if me as an advisor, I have to be able to advise the country on what they should do, advise them, and also be able to stand for them for the right thing, not just for the sake of it, but also be able to defend them. So whether it is WHO, government, whatever it is, there is really nothing that in my mind is putting me in a place where I say, is this right or not? So it is, if the government is not doing the right thing, I will say it. So if the WHO is not treating them well, I will say it. But my work in all this is to serve, not to serve an institution, but to serve the children. I was able to convince the Japanese to buy for the program 18 vehicles. This is at a time when the government confiscated all vehicles that was run by NGOs. But so no NGO or any bilateral agency would ever want to discuss about buying cars for Yemen. And right in the middle of that, I was able to convince the Japanese to buy for the program 18 vehicles. But you know how? Because I told the minister, these cars will not stay in the ministry. They will stay in my house. So, because I don't trust you. So, others don't trust you. You trust me, and I will do the right thing. And the only way I will convince the Japanese to get us these cars is if I prove to them that you will not touch these cars. And the way to do that is every time they finish, they come to my house. And they used to be parked in my house for some time. You cannot do that because that once the car comes in, it is a government property. But I was able to tell the minister that because when I tell him what you guys did was wrong, he was right. And when I tell him, trust me, that's also right. So it was all, this trust, not trust issue, but, to be on the right side all the time. You don't have to change your stories because there's no two kind of stories, only one story, which is the right story. So that's really the reason for, being able to do it. And probably one has to be careful of not crossing that line. For example, when I did my third year, and I said, okay, now it's time to go. There was no virus anyway, and Somalia and Horn of Africa were needing me. But when we started to bring in more assets, whether it is vehicles or positions, now I start to feel like all those who work with me day and night is probably now a payday and be favored, or then I say no, it's not the right it's not the right time. So that's another reason that also I had to leave, because I don't want people to think that because we worked so hard and sacrificed, that will eventually pay off in some kind of favorism.
So you left before that could happen. Mm-hmm.
And when I left, I told them why I left too.
What'd you say?
In addition, in the fact that there is no virus, and then we've done the job, and we need to congratulate ourselves. But I say, no, things sometimes can get hard because some of you already started asking me,
Did you think about it as boundary issues? How did you think about it?
I did not want to argue about it. I didn't want to, yes, we can always say no, but it was just not right,
So that, before talking about the Horn of Africa, we are at time.
I think we are at time.
Which is fine because we'll talk more. But to finish today up, I wanted to see if you could summarize from November when you arrived in Yemen through the end of your time in Yemen, where the benchmarks were. Like in your memory, where do you mark signs of progress or impediment?
I think the first 3 months were challenges because we didn't have any trace behind us on who we are, or what we do. And I think the fact that I can sit with them and be with them and work with them really gave that momentum of them willing to, the country as a whole willing to do things in a way others may think that it's really a lot, but to them it was nothing. When they mobilized the whole communication system, when they mobilized the whole ministerial system, they did it because they eventually believed that this is something that they can achieve. Plus, this is something that also takes the negative connotation about Yemen I mean, the one which I was using at those days was Yemen is the last country in Asia to have not to conduct campaigns. From then on, I think the stars lined up in a way that really it was critical for us, for the program, and especially themselves, to base the thing that we were doing on solid technical knowledge implemented in a peculiar environment. And they were very good at doing that. And as time went by, the working relationship was such that, if I tell you a story, it is a very clan-based society. And two clans could fight among each other, but if there is another bigger clan that is fighting them or then they can come together and fight that outsider, and so on and so on and so on. And there are sometimes, after all this fight, there are two clans which are close to each other that one can actually be held hostage because of something that they have done before that they have never settled yet. But for them to say, look, guys, we have a problem between the two of us. So can you send other clans to do the campaign? So, for them to even, be willing to let some others, usually what we do like that is, we find teachers from Sudan or Somalia who will not be mistaken as part of this clan or that clan, who will go in and immunize the children and go out. So the fact that we need to immunize every child was been accepted, but they knew also that they cannot do it the normal way because it may kill, So, those kind of stuff, and also eventually the way they have really taken up on surveillance.
This was after the first 3 months.
Yeah.
You saw cooperation of clans within community, certain clans that had conflict stepping out and letting somebody else.
Yeah, and, so the surveillance also, in addition to really bringing the surveillance system within a very chaotic and similar problems that Africa also has, where there's no strong surveillance system. But we were picking up cases in every corner that really, and then another very important input for me was, because I was working alone for a year and then I had one person for WHO, the part that really enhanced the surveillance part is the STOP number one. The STOP program that we have. So we had the first STOP to be also assigned there, and with their presence there, we completely finished the establishment of surveillance. Just shot before then, so it was.
So the STOP program came in before a surveillance system was set up?
There was no surveillance system. They are the ones who set it up.
Got it.
There were 6 of them. They're the ones who set it up.
Wow. And that was the beginning. So between
96,
okay, and
it was,
1999.
I think 1999, 98 it was. And then there's something also happened for surveillance. While I was there, at one point I got sick. And eventually I had to be medevaced. But the night before I was leaving, the planes leave at 10:30, so everybody was there in that working space or in my house. It's like around 5 p.m. My flight leaves at 10:30, being medevaced. Around 4:30, so I hear one or two of them discussing and saying there is a case that is reported. And it is somewhere in one of the mountainous villages. I didn't say anything. When I heard that, I went up to my room, dressed up to take my home, attire, and then asked the driver, let's go.
While you're waiting to be medevaced?
Yeah. And then the driver said, where are we going? I say, I just heard that there is a case. Because they were saying that they cannot go after, there is, flights on Wednesday. So Thursday, Friday for them is like Saturday, Sunday. So I said, let's go. And then they all stood up. Begging me and apologizing. And two of those guys got up and left to see the case. But from that day on, in their mind, that there is really no time or space to spend. Once you hear there is a case, you go immediately. I mean, it just became part of, and I didn't mean in any way of, I really meant it, I said,
You would have gone.
would have gone.
Did you go?
No, they said they all got up and say, okay, we all go to see the case. But, to them it is, with all the respect and everything, they would not have allowed me to go. I knew that. I did not know that. I did not even think of whether they allowed me to go or not. But I just wanted to teach them that if there is a case, there is no. So, you know what I mean? It is when this kind of thing happens, it happens all when we are all together. So that commitment, that definition of what it means to investigate a case, what it means to, just follow the vision, and not only you follow the vision, but bring others with you, and then go out and that's the beauty of polio eradication that a lot of programs don't have.
Would you consider that? That's going to follow a case is standard epidemiological procedure, right?
Yeah.
But would you say in a place, was there a connection between that? I guess that was the
surveillance.
form. Yeah.
Absolutely, because the even today we still have that problem everywhere. People won't really jump and go but this is a place where it is a clean slate, where there is no surveillance before, where they may not know what was the significance of doing the investigation as soon as possible.
And these were not trained epidemiologists.
Well, these were trained epidemiologists, but never done a true surveillance that has action behind it. This is the problem with all other. There is action behind it. We will collect stool sample. I keep telling them, the polio eradication is 222. 2 campaigns, 2 stool samples within 2 weeks. But that's making it easy. But I think but to really ingrain in the training that when you see a case, there is no joke. Is really, if you don't get that kind of stuff at the beginning, then you end up. Now in some countries we see that. Since I say 2 weeks, if there is a case after 2 weeks, people don't go and collect, even look at the case anymore. So it is. What I'm trying to say is they somehow, by us working very closely together with a lot of coming out of a lot of different unorthodox methods, they learn the right thing.
Would you say that was the beginning of surveillance in Yemen?
Yes, absolutely.
So does that bring us up to 1999?
Yes.
Okay. Any final thoughts, and where should we pick up next?
Yeah, I think it's, this is, like I said, Yemen did not have any other major problem. It just had, bureaucratic and traditional, not problems, traditional challenges for us. But I think Somalia and South Sudan also they have their own different. Some of them the same, but the completely different scenario. Where these are two countries that you cannot do anything because of the security problems that they have. One of them had, and the other one for logistic problem that the other one had. Thinking of reaching every child would be a challenge, even thinking about it from the get-go. But we also went there knowing that we can do it.
Thank you. Thank you so much.
Oh, you made me talk a lot, by the way.
That was great. Storytelling's great.